Uh, Thank you, Dr. Samir Gami, for briefing us about the ventilatory management, basic ventilatory points. Now we have a next very important and practical topic regarding the use of PPEs, nursing care, biomedical waste management and disposable of a dead body. So we have with us Dr. Anil from Mission Hospital. He is a director of Meta's Adventist Hospital, formerly Mission Hospital, and 22 years of experience in hospital administration goes to his credit. He has prepared specially with a vision, and I would say he has lot of innovativeness in him. He has prepared 100-bedded COVID-19 hospital for Surat city, and it is actually authorized and designated by the government also, and on the request of IMA and many other bodies he has done this job. And I have no words, you will just listen to his talk and you will realize that how much practical knowledge and the innovative things which he has in his mind and he shares to us in our group. He is also representing the hospital associations of Surat city. So welcome Dr. Anil to this platform of IMA Surat.
Good morning all of you. It is our honor and privilege to address the August gathering of the IMA members of Surat city. I represent Meta's Adventist Hospital, Mission Hospital, a 300-bed hospital which has designated 100 beds for COVID-19 patients in the private sector. I especially would like to thank and acknowledge Dr. Parul and the IMA officials for giving me this honor and privilege to take this session on 4 topics. I would mix all the 4 topics and say it as preparedness of a hospital for COVID-19. We as human beings are a byproduct of history. I say we are a byproduct of history because every year the world teaches us how we need to be prepared to face a pandemic. Every year new knowledge gets added. Every year you have new methodologies, and every year you have new wisdom dawning upon the medical professionals of this world. Today we are in the situation where the pandemic for COVID-19, and we have knowledge for this pandemic which is not even 2 months old. But the knowledge that has been percolated across the globe is useful for each one of us. First, to save the patient. Second, to save yourself. Third, to save the others who come in contact with you. So this brings about the first and foremost thing, which is training. training and development is the core for making sure the pandemic is kept in control. If you are looking at establishing a hospital or accepting a patient who walks into your hospital who might turn out to be a COVID positive patient, when the patient walks into your premises, you have no idea whether he is COVID positive or COVID negative. But as a precaution, every healthcare worker, every clinic, every nursing home, every hospital should make sure that that patient is COVID positive and make sure all the precautions that we take are as if the patient is COVID positive. The patient might be in the incubation period. The patient might be who is already not having symptoms but just presented to you at your OPD. So for this, how do you prepare yourself, being a doctor, being a nursing home, being a hospital, how do you prepare yourself? The first and foremost thing starts from the security. The moment the patient enters your premises, the security guard ensures that the patient is wearing a mask. And the entry into your premises is guarded, and everybody will make sure that the patient wears the mask. The relatives who are accompanying the patient also wears the mask. And you as a healthcare provider is already having the respective personal protective equipment. Now when the patient enters into the hospital through the gate, the security ensures that they are all donned with a mask. And when they come into the premises, you need to have outpatient triage. An outpatient triage is a place where a duty doctor sits there and then he would take the history from the patient. As Dr. Mukul Petrolwala rightly said, there needs to be a minimum distance of 1 meter. So you can keep an extra table over there and take the information from the patient accordingly. So the RMO and the nurse would take the history from the patient and make the patient sit outside your clinic, outside your nursing home or outside your hospital where there is proper shelter for the patient to sit and wait. And there we need to practice social distancing even at the waiting area. Each of them will have the mask. They will sit 1 meter away from each other, and then there will be a proper token system so you know the patient goes in and out, because you don't want more than 50 people gathering at one single place as per CDC guidelines. Now when you have a patient coming with a simple fever and you have a patient coming with cough and cold with sore throat, you give preference for the patient who has cough, cold and fever over a patient who is just having a simple fever. That is called as triaging. So in triaging, you try to divide the patients basing upon what kind of an emergency the patient has. So at the moment the emergency is COVID-19. With all the symptoms, those patients get the green channel. A green channel is something which is a small green sticker kept on the file which will show that he passes every single line and takes precedence over all others. So this training the patient has a hand rub solution. I would like to call the model Mr. Mohan to kindly come forward and show us the hand rub solution. There are a few steps which need to be followed for the hand rub too. All of us as doctors are aware how to do our hand wash. The same way we use the hand rub solution and use this hand rub to use as a disinfectant on your hands. And then you give a pinch of this solution to the patient's hand, and then he walks into the hospital premises along with the mask on. And then when the doctor sees the patient, after he takes the examination, he will make sure that the doctor is donned with all the PPE. Now what is a PPE? PPE is personal protective equipment. Now in PPE we have got many things. This is a PPE kit which is available at various medical stores. This is a PPE kit that has got a gown that is having from foot to head. They have leggings, and then along with this they also have a 3-ply mask, face mask. It also has the goggles, which are going to be told to you a little later, and afterwards it also has the cap or the mask which is used, which is called as N95 respirator. And if you don't want to use the N95 respirator, we can always use the 3-ply mask. But the doctor who's seeing the patient is advised to wear the N95 mask in the clinic. So we would like to show to you now how to don the PPE. Mr. Mohan would help us with that. Please start the demonstration, please. At the beginning, you will have the hand rub solution used by you. When you are coming to the hospital, before you even sit in your clinic, you need to first do a hand rub, follow all the steps of hand rub, and then you will then make sure that you're going to follow a protocol. So first thing is donning the PPE. Donning means wearing the PPE. The first thing the person has to do is check and see if the PPE kit is intact. We need to open and see if the gown is full, it doesn't have a scratch, it doesn't have a breach of the material, the goggles are intact, the helmet or the face shield is intact, the goggles are intact and they're in good condition, and once you make sure everything is ready and kept there, then you will start doing your hand wash. Now I would like to request Mr. Mohan if you can start donning the PPE. Now when you start donning the PPE, you need to make sure that all these things are available on a tray which is sterile in front of you. And then you will make sure all of those things are kept near you. Right next to you, you need to have biomedical waste bins. The bins need to be color coded accordingly as per biomedical waste rules. And then you'll make sure that this place is going to be used for donning and also doffing. Now doffing area is removal of your PPE. Donning area is your wearing of PPE. Both the places should be separate, they cannot be together. But in case you are having a place where you have got very less space, we advise that you doff or remove your PPE at a place where it will not contaminate the surroundings in that room. And make sure that you will ensure the safety of your staff who are going to pick up the removed PPE properly, because he needs to also have a total PPE when he's removing the biomedical waste from your particular hospital. Now once you wear the gown needs to be a minimum 90 GSM gown. Now you need to make sure before buying the PPE is having 90 GSM as the measure of the gown. The gown would also have, this particular gown has got, even the leggings are there, it has also got a zip. So it is a very, very secure gown like this. You don't need to have 4 or 5 paraphernalia hanging around you. It is more easy to don or more easy to wear. Now as he does this, he dons the face hood also, and after that he would make sure the first step is to wear the gown. That is, remember the word G. First step is to wear the gown. The second step is to wear the mask. Now masks are of 2 types. One is a 3-ply mask, but right now what he is holding is a N95 respirator. An N95 respirator is to be used by all the doctors when you're seeing patients. The N95 mask needs to be worn the way he is showing. You need to cup the N95 mask into your hand, and then you take the first ply and keep over the ears. The second ply you take it and keep it below your ears. Now use both the hands, not single hand. Use both the hands to shape the nozzle at the nose, because you will make sure you're sealing your nose appropriately. And then you have to do after this a fit test. Now he is doing a fit test right now. The fit test is basically to make sure there is no leakage all 360 degrees of the mask. The N95 respirator is actually protecting you from inhaling those viruses in the environment because you are in proximity of a patient. And you cannot breathe the same air what is there in front of your respirator. The respirator is actually breathing through the porous material which is there, and then it is trying to filter the virus, and then you are able to breathe it. So you need to make sure there is a fit test done appropriately, and if the fit test is failing, please change the PPE or please change the N95 respirator for your size. In case there is a leakage, you can always make sure that the wrap that is there at the back can also be tightened further with an assistant who is there with you to make sure the N95 respirator is tight and there is no leakage. Number 2, when you make sure that your fit test is appropriate, you will also after that make sure you will wear the goggles. Now there are two types here. One is a goggle that we have and the other one is a face shield. You can use either of it. You can use either the goggles or you can use the face shield. And in case you are doing an aerosolized procedure, make sure use both of them. Now we will show you how to don the goggles. The goggles need to be checked before use, whether it's in working condition or not, and then making sure that we keep the goggles over the face, and then we make sure that there is a kind of suction available when you don the goggles. The goggles, when they are worn, they are totally sealed all around. They are totally sealed all around, and you will not have any air coming into the eyes. So make sure that you will seal your goggles appropriately. And then you can also wear the face shield. You can also wear the face shield. And then making sure you do all this, and then again you do the hand rub solution. Once you do the hand rub solution, then you will make sure you wear the gloves. You will make sure you wear the gloves. And once the gloves are worn, you are ready to examine. Now when you are sitting in a clinic, you are wearing only one gloves. So make sure you will do your hand rub solution you will use over your gloves. And then clean up your gloves appropriately following all the hand wash steps, and then don a second glove onto the existing glove. This is for your safety and to make sure you are not having a contagious environment within your own clinic. Make sure that you will bring these gloves over the hand totally. It is preferable to have a small hole made so you can actually have the gown that has the thumb goes into it, so it's easy to pull the gloves over your gown. And once you're ready, you will again do your hand wash, that is, or the hand rub solution, and then you will examine the patient. After examining the patient, you will remove the mask, the gloves which you are wearing. And once you remove the gloves, you will again do your hand rub, see the second patient. Again you will remove the gloves, you will do your hand rub, see the third patient. In case you are getting a positive patient, to see a positive patient, you have to totally remove the PPE and then only go to see a patient who is COVID negative. Make sure you don't see a COVID positive patient and immediately with the same PPE you cannot see a COVID negative patient. So please take that single precaution. After this, we are going to show how do we remove the total protective equipment. This also has got certain steps. Now this is the most important step that we need to take because this is the most infectious part of it. The infectious part of it is the one that is there right in front of you from your head to toe, that the part which is in front of you. That means this whole thing is actually a dirt area. If you turn back, this whole thing at the back is a cleaner area, and then you will make sure that you will use these straps, you will use these other items at the back to make sure you are removing your PPE. Now when you are there in the doffing room, you will have your biomedical waste. The biomedical waste needs to be having a biomedical waste bin. It has to be a yellow colored bin with a double bag. It has to be 2 bags have to be kept in one single bucket or the drum that is there, so that when the person is carrying that waste, the bag is properly sealed and no contents will fall or leak out from the bag. So please make sure the yellow bag is having 2 bags, and then you will make sure that the PP equipment which you are removing right now is going to be doffed or removed and kept into the biomedical waste bin that is there in your room where you are removing your PP. Now I will like to request Mohan, can you start your doffing procedure? The first thing to do is to remove the gloves. The first thing to remove is to remove the gloves. When you are removing the gloves, pinch the gloves at the edge here. This is what he is showing it. Pinch the gloves, pull out and drop it in the bin that is there. And then you will make sure you will insert your hand into the gloves. Insert your hand into the gloves, pull it out and bring it out and throw it into the bin. You have not touched any dirty surface. We have followed this exactly. After that, you need to remove, you have to go back and do your hand scrub. Every step you need to make sure you have the hand rub solution used. Now he has done the hand rub. The next step would be to remove the goggles or even the helmet first. The helmet will be removed. After that, he will discard the same into the biomedical waste bin. It has to be a large bucket or a large bin. The third thing is he will remove the goggles now. Once the goggles are removed, you need to hold the sterile part of it, because you will find this is the only sterile part of it. So once you remove, his hands are clean. He has touched only the clean area and he has kept it back into the bin. After that, he needs to make sure that he will remove his gown. Now to remove the gown is a little bit of a challenge right now, because we don't want him to touch the front part of the respirator. So we need to make sure we carefully remove the mask. The mask is the last thing to remove, and now he will remove the gown from the body. Once the gown is removed, you please go ahead. Once the gown is removed, he will make sure that you will make the respirator doffed in the right manner. I will tell you how to do the removal of respirator at a later time, because in India we have N95 respirators which are very, very rare. Now we don't want to contaminate the patient. So therefore, if you are wearing such kind of a gown, he is using his hands to unzip this. So therefore, he needs to have a double glove. So he will make sure the second glove is used for doffing out the gown. Okay? There are different types of PPEs, so there are different types of steps are there for different types of PPEs. But when it comes to this kind of gown with a zip, you need to have double gloves, so that you will not use your hand to take the gown off from the dirty area, because the zip is right in the front and you need to use your bare hands. Therefore, you need to be double gloved when you are using a zipped gown. I am taking some time here because if you are not careful in removing your PP right here, you can be a carrier of COVID-19. So please make sure that you follow the steps well. Go back to the YouTube, there are plenty of videos available, but adhere to CDC guidelines, which are very, very important in following all the steps. Now he has to remove the N95 respirator. The N95 respirator, when he is removing, he will use the clean area. First, he needs to be out of the patient room. He comes to the doffing area where he has to remove the PPE, and then he'll use the clean thing, and then he'll bend over the dustbin, and then he will drop the PPE into the dustbin. We will not touch the external part of the mask. These are some of the steps which we have made. I have a video which we are trying to upload by today evening. We can always go into that video and look at the whole video and get proper knowledge of that. Thank you, Mohan. Now when it comes to the nursing part of it, I think I have another 7-8 minutes. When it comes to the nursing aspect is the backbone of either the nursing home or the clinic or the hospital. The nurses needs to be trained. First, the nurses need to be trained about all these protocols. Proper trainer need to be there in your hospital. Designate a smart nurse who knows all these things, and then they will train and conduct tests for the staff. Tell the staff that it will save their life, because if they do these things appropriately, it will save their life and it will also save everybody's life in that clinic, in that nursing home or in that hospital. Now, once you teach them about all these steps, we also need to make sure the nurse is aware of the inpatient triage. The inpatient triage is again a very, very important thing. The patient who is there in the emergency or a place where you are receiving the inpatient needs to know that this patient is having cough, cold, fever and sore throat and breathlessness. If that is so, you will still have the patient in your hospital. So what precautions are you taking to make sure that this protection is given to your nurse who is there, to your doctor who is there as an RMO, and to the other people who are there within the premises, including yourself as a doctor. So you will make sure you train them to handle that patient, because he might be a suspecting COVID-19 patient. So you will make sure you will immediately call for the 108 ambulance and shift the patient to a COVID-19 hospital or to a cough OPD which is there in the 4 designated hospitals of Surat city. And you will ensure that the nurses take all the precautions. Now, when the patient is right now having an aspect of these patients in the emergency, what would you do as a nurse? First, encourage the patient. Before encouraging the patient, encourage yourself. Be confident, because you are already trained, you already have everything on you, you have the PPE, total PPE is there with you, you are 100% secure if you have the fit test properly for your N95 mask. Have the confidence that you are safe. Then you can give confidence to others who come in front of you. So make sure the patient is already anxious, the patient is already worried, so you need to give him the right kind of the psychological support. Make sure the patient is kept at ease, and make sure you also adhere to the guidelines of the infection control protocols. And then you will ensure that you will have sufficient hand wash before doing any kind of procedure. Whether you are shifting the patient from the bed or whether you are taking the patient towards the ambulance to shift, you will make sure that you will adhere to all the protocols. And then once you adhere to all the protocols, you are assured that you don't have any risks that you are carrying for yourself, that is a nurse, nor for the doctor who is there within the premises. Ensure that the nurses, the healthcare workers, everybody in that place are well trained. Training is everything. If you don't train your staff, if you don't train your doctors, then you will be at the biggest risk of getting the COVID-19. So our suggestion is to kindly go through the materials available and then make sure you train yourself, you train your staff, and you also train all the healthcare personnel who are working within your clinic, nursing home or the hospital. When it comes to a body which is brought dead to your hospital or to your clinic or to your nursing home, you need to make some precautions. You are not sure whether the body is COVID positive or COVID negative. Let's assume the body is COVID negative. How would you take care of that body? How would you dispose the body or send the body very respectfully and hand it over to the relatives? You will make sure you follow the regular protocols, and you will also make sure that you will have a doffing bag for the body. And then you will make sure you use 1% hypochlorite solution, and then you will make sure that you will disinfect the whole doffing bag. And then you will make sure that the body is handed over to the relatives. And you will make sure the right precautions are taken to ensure that this body is properly taken from the premises. If it is a COVID positive patient and you need to give the body to the relatives, make sure you give the relatives the body and take the signature. And then also simultaneously inform the SMC authorities that you have a COVID positive dead body at your premises, so that you take all the precautions which are required. Whatever equipment was used for the patient will be disinfected with 10% hypochlorite solution. You will disinfect the railings of the bed, you will disinfect the beds, the bed sheets, everything have to totally get discarded, and you will make sure that every equipment which is there will be used with 10% hypochlorite solution, and you will completely clean those surfaces. You will also have a terminal disinfection of all the 4 walls which are there, and then you will use bleach or 1% hypochlorite solution for the same. And then you will ensure that if you want to be little more careful, you want to even fumigate your OPD, your clinic, or the place where the body was kept or the patient came, and then you will ensure that the cleaning happens appropriately. All these things need to be followed by the nursing staff. You will make sure you follow this. In case you are not aware of some of these things, go back and read about it and practice on your own. And when a patient enters the OPD or when the patient enters the inpatient area, please keep one form where the form is a form where you write down at the beginning which was a security guard that saw the patient at the gate, his name and his telephone number and his designation there. Then he came and saw the OP triage, the RMO's name and the nurse name who saw the patient at OPD triage. Then he went to the pharmacy, then he went to the front office, he went to the doctor. So wherever he is going, all his contacts needs to be entered into one register, which is a common register that the patient would be carrying with him. And if it's an inpatient area, the same thing you would do. If he has gone for an X-ray, you will write down the name of the person who wrote the who has done the X-ray. If he has gone for the blood sample, you will write the name of the person who collected the blood sample. So everyone who comes in contact with that suspecting COVID-19 patient needs to be, we need to write their names and keep a record of it for future reference when we need to do a surveillance of the same staff. Once you know you have some COVID suspected cases in your hospital or in your clinic, they have walked into your premises, you will make sure that you will monitor this staff regularly. If those same staff who has come in contact with this COVID-19 suspecting cases which are not aware, and if your healthcare worker in your clinic, nursing home or hospital is slowly developing fever, cough, cold, sore throat and breathlessness, make sure you refer them to the cough OPD, the 4 OPDs that we have in Surat City. And make sure that they are attended immediately, because they should not be they should not be an agent of contagious agent for your nearby staff who is there within your premises. Make sure that you follow all these protocols, and many more protocols are there which you need to use. When it comes to biomedical waste, as a nurse, they need to be trained, including the other healthcare ward aides and the housekeeping staff, how to carry the biomedical waste. Already you have used 2 yellow bags in the biomedical waste bin. You will seal the biomedical waste bin, and then you will write on it COVID-19 waste. You need to spell there it is COVID-19 waste, so that when it goes for disinfection to the central area, these bags are segregated to another area for disinfection. So please make sure on the bag you will write there COVID-19 waste. And then when you remove the bin from that yellow bag, you use again 1% hypochlorite solution to clean the inside of the bin and also the outside of the bin. And you will ensure you will adhere to all the protocols of the biomedical waste regulations of the government. Only one single difference is that you will actually keep 2 yellow bags to take the doffing PPE material, and then you will write on that COVID-19 waste. I hope this small lecture that we have given to each one of you would be helpful, because we have covered aspects of PPE, we have covered aspects of nursing, we have covered aspects of how to handle a suspecting body that is there in your premises, whether it's a COVID-19 positive body or a COVID-19 negative body which comes into your premises. The secret of success to deal with this pandemic is only one thing, and that one thing is to prepare yourself, to prepare your staff, and training, training and training is all that we recommend for our healthcare workers. Thank you.